morning, everyone. Thank you for being here. We are so happy to expand our vaccine offerings to more individuals, including teachers, this week. When we opened, it's been our pleasure also today to show the governor and Dr. Toomey our mass vaccination site here in at the Gwinnett Place Mall. When we opened here, we had limited vaccine, 1,000 people per day we were able to do here. Today we're going to do over 1,800 vaccines today, and we have over 14,000 scheduled in our district for this week. We have the capacity at this site to do 3,000 vaccines per day, and when we get enough vaccine, we'll be ready to do that. Again, this has not been a scheduling issue, this has been a supply issue, and we're so grateful for the leadership of the governor and Dr. Toomey. We believe that this vaccine is the safest and quickest way to get immunity into our communities. And really, this is a race of the V's, vaccine versus variants, right? And so we need an army of all of us to do our parts to stop this evil virus. And so we need all of you to practice the prevention measures that we've asked you to do to fight against those variants while we provide this very important layer of protection with the vaccine. So with that, I'll turn it over to the governor.
Well, thank you so much, Dr. Arona, and we just appreciate all that you and the Gwinnett County Department of Public Health and all your folks that are on the front lines of this are doing. Certainly want to thank you as well as Dr. Toomey for being here. Chairwoman Hendrickson is with us today. I know Gwinnett County has been a great partner with the health department here at this site. The county's commitment to this has just been extraordinary. We're glad to have the local Board of Health Chair, Dr. Radloff, who's with us today as well. Superintendent Alvin Wilbanks from Gwinnett County Schools is with us. We're so excited to be vaccinating teachers today, 600 of them just at this one site. So this is a great day for our state in the fight against the invisible virus. Appreciate Commissioner Carden from Gwinnett County being here as well. And then I know we have some members of the Community Improvement District that are here today, and specifically Ben Yorker, who I don't think is here, but Ben has made this facility available in some ways, and I certainly want to thank him. We had a great walkthrough inside, very impressive what this team is doing. They're school nurses working in conjunction with the regular folks that have been here the last several weeks to help the expanded criteria and help get our teachers educated, as well as those other eligible Jordans. Very impressive process that they have here, much like what I saw earlier this morning up in Habersham County at our mass vaccination site up there, where we had National Guard, FEMA, GEMA, state law enforcement resources, the local public health department folks, and our private sector partners, and they're doing 1,000 shots a day there. Like here, they could double or triple that. We just need the supplies, Dr. Arona said. I just want to thank everyone for what they're doing. We're looking forward to March 17th as well, where we'll have 5 additional sites that we'll have up and running. We're working on those currently to be ready for that supply. I'll just end with a couple of facts and figures, and this whole group behind me can take any questions that you got. As of this morning, over 900,000 seniors have had 1 dose or more in our state. 64% of Georgia's elderly population, which is one of the best rates in the country. The national average is 58%. And as I've said for the last several weeks, the reason that Dr. Toomey and I focused on these individuals is because they are the most vulnerable. 77% of our fatalities to COVID are in that 65 age and older group. So that is why we have been targeting them early on to help with our hospitalizations, to help with saving lives and protecting the most vulnerable. And we're just excited today that we are able to expand the criteria to individuals with developmental disabilities and some of their caregivers, and Dr. Toomey can certainly answer any questions in regards to that. If you look at the state site on what the vaccines that the state is controlling, we're given 81% of the state allocations have now been administered. Dr. Ronan was telling me earlier about how they're got doses last week that they held for this week for second doses to make sure everyone gets their second doses. So we're always going to have vaccine that's either in transport or in situations like that we're accounted for but haven't been given the shot. It's either because we don't have it or it's being held for a second dose. And I think it's important for people to understand that we're getting every dose as quickly as we can in every arm. And what we're doing is working. Our citizens following the guidance and the guidelines, social distancing, wearing your mask, following the public health guidance that we have in our state right now, plus the number of vaccines that we've given, over 2.3 million in our state. Our hospitalizations is down to, for COVID patients, is down to 1,603. That's 11% of the statewide hospital census. As you remember, back on November the 10th, it was over 30%. This is the lowest number we've had since November 10th. So at some point between November 10th and today, it was over 30%. Our positivity rate is down to 6.1%, so it has been rapidly moving in the right direction. That is the lowest it's been since mid-October. And at our state-run mass vaccination sites, much like they're doing here at the county, no vaccines are going to waste. We are getting those shots in arms with the state sites as of last week doing about 94% of the doses that we had available. Also, just want to continue to tell everybody to let's keep our foot on the gas, giving shots and following the guidance. We are seeing the light at the end of the tunnel to getting back to normal. I'm excited about that. We were talking inside about how excited people are to be not only given the vaccine, but also to be getting it. So that day is coming, and it's a beautiful day to be in the great state of Georgia. It's a great day for folks to be getting vaccinated, especially the medically fragile and our teachers. And